Now I see patients that are much younger, in their early 30s, with very low testosterone. Is this normal? It is not. Just giving somebody very quick prescription, telling them they're great and peachy, won't do it. Because if I give him testosterone and I give him a higher dose, which I have patients like that come to me, it actually will drop their production of their own testosterone and production of their sperm. They become sterile. If I give you something now, you're never gonna reconnect. Your brain will never reconnect with your testicles, and then we have to start all from the beginning.
Hello and welcome back to the 5-Hour Method with Dr. Yuabova. Dr. Yuabova, how are you?
I'm doing well. How are you, Vivek?
Good as well. Thank you. Like I was saying to you before we hit record, that today is a topic about hormones. And, hormones, there is on the internet, every day there is something new. It is probably one of the most confusing topic for me. So I'm definitely trying to make the best of this conversation.
Definitely. When I started with functional medicine, the first thing that I start with, understanding how hormones work.
Yeah.
So the very first book I published out of my 4 books, it was on thyroid therapy. I was like, let me share this knowledge with people so people can understand how actually thyroid works and how it's connected to entire system. So I started digging in functional medicine more from hormones. That's how I started. I was like, wow, this is amazing. We need to share this with population. We need to educate people as much as possible so people have that knowledge and now have this understanding how body really works. So I'm very happy and excited to share this knowledge with the audience and as well as with you. So if you have any questions, your own questions, just ask me. I'll do my best to explain in a way that it will be easier for you to understand.
Yeah, this is perfect. And I did not know that you actually started with hormones, the book and everything. So in functional medicine, so that's good. Let's just set the frame here, right? So when people say my hormones are off, what do they usually mean? Why is that often? I don't even know if that's the right question. I guess explain me. Is that even the right way to even ask question, pointing it out this way?
So when patients come to me, I ask them specific questions to understand if their hormones are off balance or what's going on. And I think I told you this before. I ask them to explain to them the entire morning. It's like, you woke up in the morning, and what mood are you in? Do you have energy to get up? Are you up and about? Are you happy? Are you rested? Very important. Are you rested? What does it mean? If this person says, you know what, I wake up and no matter what I do, I can sleep for 12 hours and I'm never rested enough, red flag. So obviously the hormones to make us awake, we have a whole bunch of them. Firstly, it's cortisol, so it should be highest in the morning. So for those people who cortisol is low in the morning, they won't wake up. Also thyroid function. You see cortisol, now we're talking about adrenals. Now there is thyroid. What about production of growth hormone? Was it produced overnight? Did this person repair overnight so they can feel great in the morning? You see, one question covers so much knowledge. We didn't even do blood work yet. They're not there yet, right? Then I ask them further questions. Let's go about your breakfast, what you feel like you want to eat, and how do you feel after you eating that? Again, why do I ask? Insulin. What is insulin? It's a hormone, right? How much are you producing? You ate A, B, C, D, and F. How are you feeling? Are you crashing? Any other signs of insulin resistance? See, if they're releasing insulin, but they're not covering for that insulin, it's not that their cells do not recognize it. So hormonal system, as we talk about endocrine and exocrine system, so endocrine system, we're talking about excretion or hormones that don't go outside or nothing is leaving the system. It's internal, such as growth hormone, cortisol, thyroid hormones, sex hormones such as estrogen, progesterone, testosterone. All of these, they don't leave the system. So what has to happen in the system for them to really work appropriately? So we feel, including insulin, so we feel and function our best and also don't age. And also on top of fertility all the time. So this is very complex, but also very simple when you understand how it works. And what disturbs all of this is signaling. Their communication, are they able to communicate? Because if you have a computer, we look at the computer, right? Computer has a box and everything is in box. Our box is our head. Is there enough signaling to send to all the endocrine system, which starts with the brain, to entire body, including thyroid, pancreas, adrenals, ovaries, testicles? This signal comes from the head. So in environment, we have so much toxicity. This signaling is getting disrupted. And this is where the problem begins. You see, it's a very specific way of understanding this. The way I address hormonal balance is very different.
So this is not really change in the number of hormones, not increasing, decreasing. It's really is this communication network getting
Exactly.
disrupted.
It's communication system. Yes, it's communication system in order to actually create a sustainable change. Meaning, it's not like patient came and she said, "Oh, I'm so tired in the morning. I'm very sluggish. I'm also depressed and anxious all the time. I'm also constipated. I lose my hair." You see how many, all of these, you already understand what's not working. If she goes to endocrinologist tests her hormones and they say, your thyroid is not okay. Let me give you thyroid hormone. So what happens here? She already has disbalance because not proper signaling. And now I'm slapping a prescription on top. Signaling never gets fixed. I give her a Band-Aid. It's a Band-Aid. So patients take this and patients feel better. As soon as patient stops, it goes right back to the way it was because we didn't correct disruptors. You need to correct this disrupting system. You need to correct the system itself so communication improves. And if thyroid is still functional, for most people it is functional, it will work and people don't need replacement. There are some cases where thyroid is destroyed for different reasons. So if thyroid is destroyed, they're gonna need hormonal replacement therapy, but only in very specific increments, not so much. So in order to help the system function better, right, get rid of disruptors. One main disruptor is inflammation. Gut is inflamed, so is the brain. You see, your inflammation, now it's like the noise that's always on the background that makes this connection of the brain and thyroid very difficult to connect. So it doesn't connect. There is not proper signaling. So brain, no matter how hard it tries to connect to thyroid, having hard time of the connection. Inflammation, it's one of the biggest disruptors right now. Toxicity does the same thing. That's why when in my 5R method, we go step by step, step by step. Even if patient comes, I do blood work and I see their thyroid is not optimal, I tell my patients, they're very open. I tell them, I was like, let's do something that actually will change how your body functions instead of band-aiding. Because as soon as I stop medication, you're going to be back to the way you were. Let's clean things around. Let's make sure you have nutrients. If you don't have nutrients, we'll give you nutrients so your thyroid functions properly. And let's see if your body can do it. If your body cannot do it, for whatever reasons, maybe it's already damaged. It happens a lot. Autoimmune disease and so on. I give them small amount of proper hormones and combination, not just one. So most patients that come to me, women, they get Synthroid. Synthroid, it's one inactive hormone T4. But in order to feel your best, you need two. You need T3 that's active and T4 in proper ratio. So the communication happens, also signaling to entire system, the cardiovascular system, reproductive system, mitochondrial function. Everything happens at once just because your thyroid now is optimized. You see? Just one thyroid does so much. I tell my patients all the time, the closer the gland to the brain, more function it does for entire body. So if you're talking about reproductive system, these glands are in the lower end of the body. So they just responsive for reproduction. And of course, estrogen, testosterone, and all of that, and progesterone also responsible for cardiovascular, for all the other things as well, but not as much as thyroid. I have never seen a patient that came for fertility and would get pregnant if her thyroid is not optimized. If her thyroid is falling back, it's either she doesn't get pregnant or she gets pregnant and miscarries, because that's where regulatory systems a signal from the brain to the thyroid, from thyroid to your reproductive system. We talk about hierarchies or physiological state of being. First is the brain, there's hypothalamus, pituitary, and so on. Then there is thyroid. Then there is pancreas. Then there are adrenals. And then there are your reproductive organs. You see the reproduction always on the bottom. So the way they are created and the design of our system is amazing. We just need to understand how the system really works so we can create this everlasting change. And of course, in order for the system to work optimum, we need to keep system clean, functional, and having as least disruptors as possible. So we need maintenance. Like everybody else, like a car needs maintenance. You need gas. It's the same thing. Did I make it clearer for you or I made it more complicated for you?
No, you made it very clear, but I have now follow-up questions there. One is, obviously you mentioned that it's a mix of things, right? It's too often I hear this, and I was telling you this, that especially men are told, like, oh, just get this hormone replacement and that's it, right? But it does not look like you just pointed out. It's not just the replacement part, because it will come back. You will feel the same temporary fix and you have this communication problem, and then that doesn't work, right? So you pointed out this is a combination of figuring out between, three things kind of you mentioned. Like one is like, see the organ, and inflammation plays a big part. So if inflammation is controlled and made that organ better, that helps. You're bettering that communication. And then with the mix of hormone replacement therapy there, that's kind of what creates an optimal solution. Is that the right way to look at this?
It is definitely the right way to do this. So we need to take into consideration on physiological state of being of this individual and their chronological age. So if you have, because our reproduction, that's why we say reproductive age, right? The best age for women, it's age 35 and younger. For men, it's a little bit longer. We say 40, 50 and younger, not 70 really. So what happens? We women go through menopause, perimenopause, men go through andropause, where it's absolutely normal for all of us to have a decline in hormones because that's how nature works, because we are no longer in reproduction. Always first we need to understand, does the body has the base of proper levels for proper functioning of a system or it doesn't? Now I see patients that are much younger, young men in their early 30s with very low testosterone. Is this normal? It is not. Will I give him testosterone right away? I will not. Because if I give him testosterone and I give him a higher dose, which I have patients like that come to me, it actually will drop their production of their own testosterone and production of their sperm. They become sterile. See, you need to understand how this works so you do this safely. I have bodybuilders come up. They look beautiful, beautiful. You give them examination and you ask them question, testicles almost non-existent because you giving them from outside. Body knows, well, I have it in my system, so much of it. Why do I need to make it? So stop making testosterone by themselves, only relying on testosterone that comes from outside. Testicles shrink, negative feedback loop to the brain. Brain thinks, wow, what is this? I do not understand this. So this connection from the brain to testicles completely break because signal to make sperm comes from the brain. And they have no sperm. They don't have any sperm. So reversal of that looks very specific. Again, we're going to stop exogenous testosterone, start building and helping them produce their own, reduce inflammation, support adrenal function. The way male and also us women make testosterone, it's adrenal glands and men testicles. Women, adrenal glands and ovaries. See? So in order for this beautiful male to start making his own, we need to stop exogenous, start endogenous inside, support adrenal glands, reduce inflammation, give proper nutrition, give proper support, and make sure he has proper elimination. You see how it's not so simple. Just giving somebody a very quick prescription, telling them they're great and peachy, won't do it. It doesn't do it.
Yeah, but that makes me a little bit scared for the situation though, because I see young men getting too many too quick, this low T therapies, and they're replacing hormones. And it's not just it's definitely not plain black and white here, right? It needs to be done in a very, very, sophisticated manner, how you explained. So I guess two questions here, right? Like why, I mean, there are several reasons why men are getting this too early, right? For sure. So one question is, men are getting this too early, these problems, and you are evaluating them, making sure it's not the first step itself is just prescription and removing and replacing hormones. So I guess, how does recovery look like that? Is it reversible at all, or is it the last resort, or how long does it take? Can you walk or talk through that,
Sure,
please?
absolutely. So most of the time, if male was ever able to make sperm before, it's completely reversible. Some men are simply cannot and never were able to make any sperm. There's some men that born with specific genetic conditions. So we need to find out first from the beginning. Were they able or not? That's very important. We need to know what we're dealing with. Then very specific steps have to take place. Like I always speak to my patients and my consultations are quite long and I explain the situation and I tell them how I just explained it to you one by one, how the system actually works. And I let them make the choice. If reproduction is number one, usually for these young male, usually that because they did what they did, it took the specific toll on the system. Now they have different goals. Now they want family. Now they want children. Now they want everything, which is great. I explain to them timeline is very specific and you cannot do it overnight. Most of men that come to me, they're already on testosterone replacement therapy over a decade. They start so young. They start in their early 20s. So all that, let's say damage needs to be undone. How do we undo it? Firstly, with understanding, educating the patients. That's what happened. That's what we need to do first. Let's start reducing the inflammation. Stop the testosterone. We're going to stop testosterone. I want to see how your body will pick up. Give all the proper support, adrenal function, support thyroid function, support nutrition, reduce inflammation. We do everything at one time, everything, because we don't have years for this. The wife is already waiting. She's waiting for him to make the sperm. So in order to start making one sperm cell, it takes 90 days for this sperm to be able to ejaculate. Think about it. How much time will it take for me to get system properly communicating again from the brain to the testicles? So the brain understands, now I can actually signal. And now testicles actually listening to me. If these testicles not completely atrophied, because they become very small, they become atrophied. So let's see this. So inflammation, reducing inflammation, it's very quick. Still, when people get into proper state of resilience, it's about 4 months. You want it or not, it takes time. What I hear from my patients, oh my God, I didn't know that my stomach could get so flat. Wow, my muscles, they look like they're really cut. Although we got rid of testosterone. She's like, wow, I like this better because I ask them questions. How is this looking for you? How are you feeling? These patients usually go through very short period of androgenism. So when exogenous testosterone no more, and inside they just started to make for 2 to 3 weeks. They become, I'm a little more sluggish. I don't have the sexual drive. My mood is not so great. I always tell them, listen, we gotta wait. If I give you something now, you're never gonna reconnect. Your brain will never reconnect with your testicles. And then we have to start all from the beginning. They are great at understanding and they actually wait. When this period ends, they start making their own testosterone and you see all of this back, but that's their own. Testicular size a lot of time changes and becomes bigger. Like whole thing. Now I tell them, it's like, think about that you are an early teenager. Your body is just learning to do this again. Like it's a lot of damage. We have to undo and wait until your body will catch up with this. And body catches up. So what we see, let me explain to you, normal semen analysis and account. In a normal and healthy male, we should see about 40 million of sperm cells to 1 milliliter. Although World Health Organization has reduced this number twice already. And now it says around 20 is good enough. I never seen a woman that gets pregnant out of a husband who only makes 20. Not yet. Okay? So 40 is a great number. So when male starts making sperm, one sperm cell takes about 3 months, 90 days to be ejaculated. In 6 months, so from the beginning to the end, lots of times we see no sperm. It takes longer time to make and be ejaculated. And by the time it reaches 40 million, it's going to take time. It's not your 1 day, 2 days, 3 days. People need to understand. And I always educate my patients. 3 months after we start the program, we do semen analysis and we see if anything spilled yet. I ask them, what's changing? Your sexual performance, your energy levels. Of course, we need to know testosterone, how much testosterone they're making, because damage is done. But in order to reverse it, we need to understand, are they going to be able to make enough by themselves or not. So then we can continuously support them.
Very interesting. Just on the other side for women, right? Is it in a similar way? It's the same way that, first of all, my question is I never heard, is this the same problem you're seeing in the younger women? Like how younger men have, hormone problem? Are you seeing in the younger women too?
I see it into both genders the same, exactly the same for young women and young men. So now I see women in their early 30s completely menopausal, completely menopausal. And these women do not take hormones. They just become menopausal because their system prioritizes their well-being, not reproduction. So for them to survive, the system we have, the body is so amazingly intelligent. For the system always to maintain your life is more important than having a baby. Always. There are different reasons, and it's very important to find that reason why the body decided that reproduction is, out of equation. What happened? So if you think about it, Vivek, when we have hard times, for example, we are outside and it's very cold and you're not dressed, what you're going to feel first, that your limbs, your arms and your legs get cold first and your body is warm. Why does your body do this? It figures out you can live without arms and without your legs, so it's going to hold all the blood supply in your core. So your heart is working and your lungs are working. The bowel will be slow because it's not enough blood supply. It's going to keep your body at the core warmest. It's the same thing body does when it has to choose. Do I keep myself alive or I spend energy of creating another life? So it is very specific. That's why, again, educational piece of all of this is so important because people don't understand it.
Yeah. And speaking of reversal of treatments, the same way in women also it's reversible in a similar fashion. And
Most of the time, it's reversible. Yes, we need to understand where it's coming from. So, my latest patients that had the same situation, it's a lots of time, too much stress and parasites. It's very invasive parasitic invasion into the system. Parasites eat too much. There's no balance, and body's just like they're already there. By the way, when we have a fetus feeds off the woman too. So body gotta choose. You only have so much to share with something or somebody. If it's not enough to share, body will make a choice for itself. So when I have a patient coming forward and stating, I'm having miscarriage back to back, I usually ask them question, can you please tell me list? First, I want to know how many you had. Secondly, in what gestational age? And what I usually see, first, when I was 4.5 months pregnant, almost 5. Second one was almost when I was 3.5 months pregnant. You see it's coming shorter and shorter. So body has this threshold, cannot hold it anymore, and constantly can only tolerate less, and less. Until it says, you know what, that's it. What about pregnancy? I can't even maintain myself. And next step, perimenopause and menopause, done. There you have it. So I honestly thought of this. It's scary because that's happening now throughout, but still appreciating the system that we have because it's only gonna prioritize itself. The body only wants itself to survive. If it can't do anything else, core body organs, we're always talking about core, the most important organs to survive. And honestly, it's not very difficult. Actually, I should say it's very difficult to kill somebody because body will always do everything possible. We have all mechanisms to survive. So it's not very easy to actually take somebody else's life because the way body is created, always to self-protection. Always. And sustaining vitality, it's absolutely amazing.
it's fascinating how it works your body, right? It's like goes into that mode and protects you the first, like make you live first, right? Then everything after that, right? That's what,
Absolutely. It's
yeah.
very, very interesting. That's why when I'm explaining it to my patients, first thing they look at me, they're like, wow, nobody told us this way. That's first. Secondly, it actually makes sense. Why don't we think about it? They should be thinking about it. This is how it works.
Next question is on gut health, right? So a lot of time, I don't know if this is a myth or reality. I want to do a double check here. A lot of time when I hear it says like the number one thing associated with hormonal imbalances, you look at the gut health. Is this statement true? Let's start there first and then go into explaining what is like how much role is there organ that plays more role than the other.
So I absolutely agree. Gut is the most important organ, and it's absolutely humongous in hormonal health. And I will explain to you how it works. So our digestive system starts with the mouth and ends with the rectum. You see how big it is? It includes liver as well. People also don't understand that. So if somebody else's digestive system doesn't work, meaning they're too inflamed and they cannot absorb nutrients, your endocrine system already would not work because you already nutrient deficient. When we eat things that cause more inflammation, when we eat things that we cannot digest, and everyone is absolutely different, and we test patients, what's their inflammatory markers, what they can eat or cannot eat, like we do the allergy testing too. Eliminating all of that, you reduce inflammation by maybe 70%. If patients follow. So let me explain to you conversions of non-active hormones to active hormones in your digestive tract and in your liver. Let's again look at thyroid. Thyroid releases two hormones, T3 and T4. So T3 is active form. We only make about 15%, and the rest is T4. Most of doctors and endocrinologists only test for T4 and TSH. So they're testing the signal of the brain plus inactive hormone. If I want to know how somebody else's thyroid is working, I'm checking for 5 different things. So I understand the entire system, how it works, right? So if I want somebody, a patient, to have more energy, I want to make sure that this patient, or improve their fertility or testosterone production, I want to make sure they have enough T3 active hormone because that's the hormone that's going to affect everything else. T4 does not affect much. So in order for non-active T4 to become T3, it's completely reliant on your gut and your liver for conversion for active form. But if your gut is inflamed and your liver is fatty, will be no conversion. So for blood tests, you will test for T4 and TSH is going to look okay, but people still going to complain of the same thing, you know? Well, and then another question, why I feel like this? I'm tired, I don't have energy, I'm not very happy, I'm depressed, and I'm also anxious, I'm also constipated, I'm also have erectile dysfunction now, and I'm very young, and my doctor tells me that my hormones are absolutely normal. So we need digestive system, and we need it to work specifically to optimize the function of our hormonal for reproductive system. Ability of liver to excrete is very important. Why is it important? For example, we women make more estrogen and men still make estrogen, but much less. For example, for women, very important to make this estrogen, utilize the estrogen and excrete it so it doesn't become toxic. If liver and gut doesn't work, this estrogen estradiol goes up, make women estrogen dominant. Is there a problem? Of course it's a problem because these now women become in more risk of very specific cancers because the estrogen is so high. Higher the estrogen, more inflammation you have, and vice versa. More inflammation means more estrogen. Estrogen means more inflammation. It comes hand in hand. And we're talking now about cellular inflammation. It's inflammation of the cell. It's oxidative stress, the stress of oxidation. What's happening with your cells? They break down, they don't work. You see, so this is so important for men with fatty liver. When I have a gentleman coming in and they feel great, but they have a little pouch, they say, I'm good. The only problem is that, I work out and this pouch never goes anywhere. I'm looking at them, I was like, listen, for amount of years I've done this, with the way you present physically, you have fatty liver and you have a lot of testosterone. And they're asking me, how would you know that? We didn't do blood work. And I tell them, you are not burning the fat and you're not producing enough testosterone because your liver is so congested. We call it fatty liver because when we do blood tests and we look at specific liver enzymes, you could see it. Again, liver is part of digestive system. You don't fix this, nothing else will work.
If somebody has fatty liver, right, and even doing fastings like ketosis, things like that, does that help at all or is not going to help? Like, I've heard both things, right? I've heard like some say like, yeah, it really helped me get back to normal and it helped me. But what's the real answer?
So the real answer, sometimes for some people it's beneficial and for some people absolutely not beneficial whatsoever. So why liver becomes fatty? So fatty liver is when liver cells, hepatocytes, change their function and they don't work anymore. It's not pockets of fat inside. No. They actually become bigger, but they're useless. They don't work the same way, the way they should be. What causes that? Toxicity and inflammation, chronic toxicity, chronic inflammation impacts on the function of the liver and the cells. And again, in order to improve that, once you address the liver and digestive tract, men's testosterone increases, C-reactive protein decreases, all again, we're seeing all the same thing. Why does this happen? Number one, toxicity. Secondly, deficiency. Everybody now deficient on nutrients. Food does not offer nutrition. There's not much in it. Supplementation, people think, oh, I'm going to take this and that, it's going to help me. They're not understanding by doing this, they're actually causing more harm and causing more inflammation. Because in order to know what to take, you need to employ somebody. You need to get somebody else's help who will guide you through this. Don't do it by yourself. You don't have enough knowledge. You don't have enough experience. You need this expertise, trusting somebody so somebody can guide you through this. But just because we are such a beautiful being, resilient, I see it all the time. Fatty liver, and 6 months later, no more fatty liver. There you have it.
And nervous system, right? Like now this is a layer outside of the biology. We discussed a lot about this. Now somebody who's anxious, whose nervous system is whack, stress, right? How that has direct impact on the hormone imbalances. Does it cause some other thing biologically and that triggers imbalance, or is it something else? What's the real picture?
So everything is actually chain reaction. Nothing works separately. I tell my patients, I do my best not to stress anybody, no matter how bad the blood work looks like. Before they leave my office, I tell them, please don't stress. Like, we are looking at your picture further, but it doesn't mean you're dying. What it means, we need to change things so you can be healthier and you can live life the way you want to with best quality, and you're active and you want to do whatever you want. So I want to take that stress off their plate. And that's why when we offer programs, they're all done for them programs so they don't think, so they don't constantly, dig for information. We give them information, we give them the knowledge, and we also give them basically the Google Maps with direction. We give them everything so they don't need to look anywhere else. And we're also available to tell them. Nervous system, it's a brain, it's a first system. And I tell my patients, if something will not kill you, the stress definitely will kill you. Please stop stressing. Stop stressing. Definitely, because what body does, the stress, amount of cortisol people release, if it shoots out, it adjusts your hormonal balance throughout the system. Amount of cortisol you release will change how your thyroid works, how your pancreas works, how your testicles will work, and how your adrenals as well as your how ovaries will work. When cortisol is elevated, everything else goes backwards. Everything goes backwards. So it is so important. We teach our patients how, yes, life is here. We are here. And we are in a time with lots of stressors, but our reaction to stress needs to change. If life is changing, we need to be adjusting first with our thought process and prioritizing physical well-being. Eating on time enough, resting on time enough, sleeping enough, and making sure we're sleeping deep enough. You see, most people now work 2 jobs. It's already stressful. They already have kids. Lots of stress. Kids are now, and as I spoke with you, they're very different than the way we were. It's also stressful. So how do we prioritize and how everything gotta change? If somebody has chronic stress on the system, stress could be either exogenous or it could be endogenous, right? What I said, it was exogenous. The life is hard. If people think it's hard, it's going to be hard then, We have to say, no matter what it is, I know I can manage because God created me this way. Whatever comes on my plate, I can deal with it. You see? Different. Already thought process is different. If we have an individual that have chronic virus, bacteria, parasite, their system will be chronically stressed. This is endogenous stress. If that doesn't get corrected on time, eventually cortisol release because it releases out of adrenal glands. Eventually, ability of adrenals to overcome stress will stop. When there is not much cortisol left, these people fall into category of people with chronic fatigue. Chronic fatigue is debilitating condition. People cannot get off their bed. They cannot function. They don't enjoy their life. They cannot do anything. All they do, they eat a little and they sleep the rest. Eat a little and sleep the rest. I've dealt with patients like that and explained to them, one pill will not fix it. Firstly, we need to feed your system. We need to give its needs for repair. As soon as it's going to start repairing, we need to find what caused this chronic stress so we can eliminate. By doing so much work, feeding and eliminating and supporting, now we're getting proper communication and signaling from the brain to whatever organ needs be so it can function normally. As soon as we support thyroid, adrenal function for these people, they get off the bed, they start functioning, they go to work, and they enjoy their life. See, I just now explained to you how this works again. And again, everything is one system. Addressing it properly will change everything for these people.
This is the greatest conversation I've had understanding hormones. I have to say that. So very clear picture is thanks for painting it. Before we conclude today's conversation, I still have one last question on, how when someone realizes it, right? Like when they know there's something off with me, I'm feeling this thing. And a lot of time people do their own things. I get it. Somebody says like, oh, I'm gonna eat good food, or I'm gonna do more exercise, or I'm gonna go on these supplements diet, right? There's ways people do it, right? But what is like the first step that you recommend that, that is probably the best step you can do for yourself, right? Like what is that?
Sure, absolutely. Number one, you need to have the facts for yourself. If you don't feel your best, you need to take a pause. You need to understand the facts. What is going on? You need to understand what's happening before you jump into conclusions on doing things. If you're able to employ somebody to guide you through this process, employ somebody. Go meet somebody, go speak to somebody, see how you understand each other. It's very important to understand your provider. It's very important to be heard. It's very important to be understood and guided. Don't do it by yourself. When patients come to me and they say, oh, you know what? I don't feel so great. I'm tired every morning. Usually what they think, they need to exercise more. They don't need to exercise more. They need to exercise less because there is not much energy. Why are you spending the rest of it for exercise? Your body is not going to repair better just because you're exercising. You're wearing yourself out, and it will be a moment where you're going to fall into fatigue state. Don't do that. Your body is already not managing. Let's do what's necessary and do it right so your body can repair. One thing, as I told you before, what people can do, they can sleep more and see if the body manages. But most of the time now, it's not enough. It used to be, sleep a little more, you sleep it off and good. That's why we said it. You will sleep it off because during sleep, if all the systems still working properly, the growth hormone release will repair everything that's damaged. It doesn't happen anymore. It's not enough. For those who are not feeling great, the first thing you pay attention, how much you need to sleep and how deep your sleep should be. It should be deep for you to repair. Reducing inflammation, everybody has different inflammatory factors. Diet should be specific to this individual, not some generic thing that people talk about. No, it should be like that. We need to understand that being is an individual being, and everything that this individual needs, it has to be individualized. By practicing this very specific medicine, the way I practice it, every patient has their own protocol, their own. Diet is exactly what they need. It's not, I don't have two people doing the same thing. Ever, never done this way. But then I have great results because it is highly individualized. There is no more individual than that because this is exactly what they need. So if somebody feels they're tired, they're not repairing, and they maybe went to doctors and tried some things and didn't work, look for somebody else. Find somebody else who will hear you, understand you, and will do everything necessary to help you.
Great explanation. And I would like to conclude this by saying that, well, when we start listening to those signals, really, that's when we will truly understand what's happening. And that's the point you're making here. And a lot of time, like you said, we just try to go to the solution before understanding what it is. And unfortunately, we are all at that fault, right? We just see something and it's just how things are shown in today's world. Once again, Dr. Yuabova, this is great episode. Thank you for sharing all the insights, and I benefited a lot. I'm sure people are going to benefit a lot too. So if today's conversation helped you, especially to our listeners, and you see health in new way, share this episode with your friends and family, especially if you see them struggling with the various symptoms we had discussed in this conversation. And of course, if you are ready to understand your own body, might be asking those questions. And if you are in Boca Raton, then you should visit Dr. Yuabova's office, National Wellness Group, or you can also reach out to her if you have any questions through nationalwellnessgroup.com. Thanks for listening, and we will be back next time. Thank you.
Thank you very much, Vivek, for having me.